Good evening, and thank you for joining us tonight for Supporting Student Athletes, Sports Injury Rehabilitation, and Tips for Athletes with Academic and Organizational Challenges. We have some great presenters for you tonight. So without further ado, let's introduce them. First up, we have Katie Marino. Katie is the Director of Outpatient Centers at the TheraPlay family of companies. She attended Misericordia University and she joined TheraPlay in 2007 as a physical therapist. Katie has experience working in our outpatient settings with a focus on manual therapy and sports injuries, and she enjoys working with all pediatric patients, but has a special passion for treating patients with concussion, sports injuries, and medically complex children. Next up, we have Dr. Marco Alcala Jr. Dr. Alcala is a sports medicine physician, non-surgical orthopedist, and concussion specialist, and he serves as the director of sports medicine at the Allegheny Health Network Pediatric Orthopedic Institute in Wexford, Pennsylvania. He is currently one of the team physicians for the Pittsburgh Pirates and Avonworth High School, and serves as a district physician for Avonworth School District, and is the director of orthopedic training for the Family Medicine Residency Program in affiliation with the Heritage Valley Health System. Dr. Alcala is board certified in both family medicine and sports medicine. He is a member of the American College of Sports Medicine, the American Medical Society of Sports Medicine, the USA Boxing Association, the American Association of Family Physicians, and the American Board of Family Medicine. Last but certainly not least, we have Katie Bell, the Associate Director of Athletic Academic Support in the Center for Enhanced Performance at Army West Point. Katie is in charge of academic support for the football team and men's soccer team and works with cadet athletes that compete at the NCAA level, strengthening overall academic skills, time management, and test preparation to encourage academic excellence. Before coming to West Point in September 2017, she served as an academic support assistant with football at Penn State University. During her time at Penn State, she provided academic support and mentorship to her football student athletes. Katie holds a Master of Education degree in higher education, as well as a Bachelor of Arts degree in criminology with a double minor in psychology and sociology from Penn State. We thank everyone for joining us tonight, and we're excited to get started. First up, we're gonna go over injury prevention.
And it's really hard when there is that pressure from themselves to get back and they want to be back. They don't want to let their team down. They don't want to not play. But the sooner that they go back when they're not fully recovered, it is a significantly higher percentage of them that end up back being re-injured and worse off. So say they have an ankle sprain and it's a grade 2 and they come to PT for a couple sessions and they're like, oh, my ankle feels great. I'll just tape it. I'll run back out on the field. Typically, then we're getting them back because now we have a worse ankle sprain, potentially needing surgery because they've done a complete tear of the ligament. And then the recovery from that point takes just that much longer to recover, when if we would have just had that more comprehensive rehab, let them get back to their 80. Usually I try to return kids back to full sports when they're about 85% to what they previously were. And again, it's a gradual rebuild in there. It is, let's return to practices first, then games. And if it's a contact sport, then we go back to contact. So kind of knowing that, and it's a lot of education for some of these kids because these prepubescent kids or adolescent kids, they want to be back. They don't want to be injured anymore. And it is really important to know that more than 3.5 million children ages 14 and under get injured annually playing sports or participating in recreational activities. It is really a very common thing, and it's something that is important to kind of do like a little bit of the wait and see thing. They might have tweaked their ankle and feel better the next morning. I'm not encouraging everybody to run to their urgent care and get x-rays and do all this stuff, but I think it is important to make sure that you're doing what's best if that injury and that pain does persist, to seek out the advice of, your doctor, an orthopedic, a physical therapist, in order to make sure that everything is intact and functioning appropriately so that they are not at risk for further injury. And the other big thing is if they are injured somewhere, they will compensate with other muscle groups. So if they're injured at their elbow, they're going to compensate at their shoulder and their wrist. So typically it's the joint above and below where they're going to put those two joints then at risk. So now not only is their elbow injured, but now you can be looking at a secondary injury that's caused by the compensations that they're doing in order to compensate for their pain that they're in and for the lack of strength and muscle groups that they have to support that. So kind of just summing up my part, it's really important to kind of go back and forth and make sure that both, the opposing antagonist or the antagonist and the normal muscle that would work, like so biceps and triceps are both strengthened. It's not just the muscles that you use for that sport that you want to focus on building, but rather build them all and build them in a functional way so that the opposing muscle can help to prevent the injury of the muscle that's working. So that's my spiel. If anybody, what sport has the highest injury occurrence? Oh my gosh, let's see. Probably all of them, but basketball is definitely one of them. Thinking about the running, the shooting, even though it's not a contact sport, there's a lot of lateral movements and agility that's involved in that. So typically a lot of knee and ankle injuries, a lot of jumping where they have to absorb that shock. So kind of just thinking through that as well and being prepared that it's not always something that they're going to get hit or fall and get hurt, but it could also just be a quick movement that they make that tweaks, their knee or their ankle.
Katie and Dr. Akala, not to put you on the spot, but do you think that has anything to do with the lack of protective equipment because basketball players don't wear a helmet and.
So, I mean, from like a joint perspective, I think that proper footwear helps a good amount, but it's really just the torque that they're putting on their joints when it comes to some of that stuff. So I would say there isn't going to be much equipment from a basketball perspective, in my opinion, that would prevent some of those knee and ankle injuries besides good footwear. I don't know, Dr. Alcala, you might disagree.
No, I agree. You got to have the right protection with as best as possible. You're not going to fix everything. And to be perfectly honest, you're not going to ever address and prevent every injury out there. But the longer you do the same thing over and over again, which is why you want to cross train in different sports, is so that you don't keep putting yourself at risk of repeating the same thing over and over again. Why do people say having a boat is it's a bad investment? It sits there and rocks back and forth, the same thing over and over again. Things just fall apart. So doing the same thing to the human body, I think something's bound to happen at some point. So you can condition it as much as possible. You can prevent. For me, prevention is going to be strengthening those areas, get that functional training, the proprioception, the kind of therapy that we ignore because, again, nobody wants to stretch. I don't want to stretch that much, but we do so when there's an injury, and that's after the fact. You want to try to do these things early on, condition them so that you don't get to that point. But the key is, once you do recognize an injury, to address it as quickly as possible so you can get back in there, not prolong it, prolong the inevitable. Then you get chronic pain.
Yeah. And I kind of think too, like a segue probably into your section, is that, when they fall and hit their heads, all that goes on with that. I think that's probably, a lot of injuries as well in that sport.
The other issue that I'm sorry, Katie, were you going to say something?
Oh, no, you're good.
That blurred background throws me off. I forgot what I was going to say. You kill me.
Yeah, well, I think,
I have a concussion here.
I'm sure there's not a sport that you haven't seen a concussion injury from. I would imagine.
Right. Okay. No, what I was going to say was with a concussion injury, getting the helmets and the gear, like we think that that's going to make a difference, and we're surprised. Well, why did my son get a concussion? I bought him the most expensive helmet. For soccer, we want to get those bands that protect the head. I don't understand it. Like, I bought 2 of those. I don't know why she's getting a concussion. It's the brain still bounces inside, and I don't want to take the talk just yet, but the brain does bounce inside. There's misconceptions out there that we need to kind of clear up. That I have to hit my head to get a concussion. You don't have to hit your head to get the concussion. The helmet's not going to protect the concussion because you don't have something blocking your brain from stopping suddenly and then bouncing back and forth, and that coup counter coup type of injury. We don't have things to protect that. We can slow it down, we can try to absorb it a little bit, but all those things do is protect the skull from fracturing and having lacerations and protecting other injuries. They're still good for other injuries, but I still think you need to recognize when there is a concussion injury and address it. And just because the person looks fine doesn't mean that they actually are fine. So I also equate it to people with migraines. We don't see them, but we accept them and we know that they're real. And that's what people kind of feel, like a migraine, like a disability that they can't explain, but everything bothers them. They're sensitive to everything. And that's why people keep pushing through, because of the peer pressure. You look fine, therefore keep going. But I'm not ready to talk about that unless you guys are.
No, I think,
You want-
Katie, do you have anything else? Otherwise, we can segue right into.
No, I mean, I'm good into that. Like I said, I mean, I think my big point to hit home is truly that they need the balanced cross training exercises. They need to have that stretching component. They need to have that warm up period, and also that cool down where they re-stretch that muscle that's just worked. And I think that that's a big thing that people forget about, is they tear down all that muscle. It needs to then realign to build back up and build up well. So while they don't need to be doing, 30 minutes of stretching at the, the end of a game, they should still be stretching out their muscles so that those fibers can, be realigned and then build up appropriately, versus kind of maintain that bad, not a bad position, but like that work position, and then not realign and build up properly. But yeah,
But we have to give it that opportunity though, right? We have to give it those chances to recognize that, and people just keep going through it, and no one's fault. They just don't understand that it's always about that game right then and there. It's about this weekend. It's about tournaments coming up, but there's never the right time to have an injury.
I mean, and again, like I said, like as a parent of a very competitive sports player, there is a lot of pressure. There's pressure from coaches, their teammates, on themselves. And I mean, I can also say it, like, if my son's like, oh, I'm sore, I'm like, just get out there. We got to warm up. You'll be fine. Like,
we paid so much money for this. Get back in there.
Exactly. I mean, like, what was it? 2 weeks ago, he was playing soccer outside with his friends, and he like kicked one in the shin, and he was like, my foot hurts. And I'm like, I'm like, oh, this could be a 5th metatarsal fracture. Like, we could be in big trouble. And I'm like, put that skate on, like, it's good. But he felt better in the skate. And of course, then, like, as the day went on, he felt better. But there is that, like, okay, I know your team's depending on you. We got to be there at 5:30 in the morning. Like, how do I tell your coach? Like, but again, being the person who, as the PT, I'm like, okay, we still have to preserve you, because you being out for one game versus you being out for an entire season is completely different.
I agree.
All right, I think this is probably a good segue into you, Dr. Akawa.
So I do see about 250 concussions a month. I fell into this and I enjoy it. I have a humanistic approach to this. I'm pretty much as vivid as possible, because you're not going to change people's behavior. You're not going to change what they're doing. What I found is that when someone does have a concussion, their fear of coming to a doctor is you're going to sit them out. They're not going to be able to do anything. Same thing with UK, like they come in with an injury. You come to a sports doctor or someone like you and I, we know that they can do other things. We know that they can work around that injury. You put them in a boot, they think, oh my God, the world is over. They can't perform. They can't. I'm like, wait a minute, you can still go to the gym. You can still exercise. You can do chest, back, triceps, biceps, everything. You can condition. You can go on a stationary bike. You just can't run right now, and they're like, oh my God, I can still do that. I thought I would have to stay home and that's it. No. So I think the misconception is that you don't want to go see a doctor because you think we're going to shut you down entirely. And when I found with the concussion is that you don't need to be that specific. I'm very specific. I'm very detailed oriented. So I'm going to give you parameters of what you can do based on what your symptoms are, based on what part of the brain you injure. And that's why I think it's nice to go to a sports doctor when you do have a concussion, not for fear because you can't play, but fear to the opposite of it, like that you can do things, not pat you on the back and say, take it easy. And then now you're 2 months out and you're like, oh man, you're just going to just take another couple of months. It just, it just takes time. A tincture of time is what you hear from neurology, from every other department, because Nobody wants to talk about vague symptoms, headaches, eye disturbances, blurry vision, dizziness, nausea, headache, fogginess, can't sleep right. Nobody wants to talk about that. That sounds so vague. So what I found was a way to explain to patients and parents, especially, to teach them that these symptoms can be organized in a certain way. And I know Katie's on too, and I know that from Positive Stats, and I know she can vouch for me that it's the way you deliver the information. It's the way you explain to people that you have a bunch of vague symptoms, but if you can make it understandable for them, such as depending on what part of the brain you injure, you can have ocular disturbances. My eyes go side to side. I do this all the time. You don't realize you're doing it, and you don't realize you're giving yourself symptoms, and you don't realize that you can stop them and not progress and still enjoy the rest of your day if you know when to stop. So not just patting someone on the back and telling them take it easy. That means anything for anyone who's type A. That means anything. That means I'm used to doing 20 things at once, and you're telling me to take it easy, so I do 17 things at once, and I'm still having symptoms. I don't understand what's wrong with me. I'm going crazy. I feel slowed down. I feel dumb. I don't understand. I'm a high achieving honor student. Those people take a longer time. So you can recognize that almost immediately when you see that person in your office. You have a daughter with the parents, and she's top of her class. She stopped it. I'm like, she's going to take a longer time because she does not know how to stop. And stop is, if you had an ankle sprain and you walked across the living room floor and a kitchen floor, and you get to the kitchen and you're finally like, oh my God, my ankle's all swollen now. Now you're laid up on the couch for the rest of the day because now you can't walk on it because you pushed it. But if you were to walk on that ankle and you took 3 or 4 steps and it hurt, some people actually stop right then and there and wait a few seconds. And then they take another 3 or 4 steps and they stop right there because the pain just got worse. Pain tells them when to stop. In this case, nothing tells you what to stop except that I just get eye strain, but it's not a big deal. I get dizziness, but it's not a big deal. I get headaches, but it's not a big deal. That's the same thing, you walking on that ankle, and every time it hurts, you keep pushing through, and they keep pushing through that eye strain, they keep pushing through that dizziness or pushing through that confusion for the cognitive person, they flare up. And when they flare up, that's when they get everything. That's when your brain goes haywire. And now you're sensitive to lights, noises, you're irritable, you're foggy, you're so wiped out, like somebody who just got a migraine and they have to go sleep it off. And 6 to 12 hours later, they recover and they feel better again. They're like, oh my God, I feel good. And they go and do it all over again, and boom, they blow up. So I call it a blow up. You flared up. But we're teaching them that there's a couple of symptoms that come just before that blow up, so they don't ever get to the point where they're exhausting their brain and pushing it to the limits where you're done and you're miserable. And you come in talking about all these vague symptoms, that scares everybody away. So if you teach people what comes just before those symptoms, they can control it. It's like an on and off switch. So to kind of talk about that for a quick second, the blow up is the part of the day we're trying to avoid. That blow up is a part of the day we're trying to make people prevent because they're miserable and the brain does not heal as quickly as it should. It's not at rest anymore. But what if you could do all the things you wanted to do and you just knew when to pause, and you can still enjoy your day successfully? You can still study, you can still exercise, you can still have a conversation, you can watch a game on TV, you can play video games, but you just have to know when to pause. And the problem is, we think we're not doing anything. But if my eyes are affected and I'm watching the screen back and forth, watching a hockey game, or I'm talking to 2 different people back and forth right next to me, I'm having a dinner conversation with my parents and I'm looking at back and forth at them, my brain doesn't like it. That part of the brain that's injured or bruised up doesn't like it, because it depends what part of the brain you injured. In this case, that part of the brain doesn't like it. So it gives you eye strain as your first warning sign. And you see people struggling, reading, trying to push through, and they're trying to make sense of what they're reading, but they can't because their eyes are bothering them. But they push through. So your brain's like a balloon, it fills up, it gets irritated. Here's your eye strain. They don't know that they can control it. So they keep looking and they keep doing the same thing and they push through. Now they're getting headaches. And then they don't understand that they can control that either, but they keep pushing through and they pop. Now they're just wiped out. And you see that look in their eyes, like they're just done, like a deer in headlights or zombie-ish, whatever you want to call it. They're just done for the rest of the day. They need to just go hide out somewhere because everything bothers them at that point. But they saw it coming, or they felt it coming. They had a chance to stop. All I did was tell them to stop moving the eyes for a few seconds. You talk to your father for a few seconds, then you can talk to your mother for a few seconds, but you're not going back and forth. I don't have to stare at the hockey game. I can look away for a few seconds, let that air out of that balloon. Within a few seconds, I feel better and I can go right back. But they don't. They push through because they're so in the game. They're so in the zone. They just want to keep watching. Oh my God, now I have a headache. And they're still staring at the TV. but their balloon is more full. Their brain is more irritable. It's irritated. It's further downstream. Now, if they simply stop moving their eyes, they can still make that headache go away and the eye strain go away without medication. They just have to stop the activity that caused it to come on. And within 20, 30 minutes, that headache goes away too. But it's when they push through that eye strain and push through the headache and then they pop. Now it takes 6 to 12 hours to recover and they're miserable for the rest of the afternoon or the day, or they're done at school at third period and they're done all the way to the rest of the day until they come home. The other part of the brain that could be affected is the vestibular ocular pathway. So that means head motion. That means simply bending down in the morning to put your socks on. That back and forthness that they neglect because they think that they're not doing anything. That's enough to stir that part of their brain because it doesn't like it and they get dizzy. So we found dizziness to be that first warning sign. If they just stop moving their heads for a few seconds, they let the air out of the balloon, they feel better, and they can go back to putting their clothes on or brushing their teeth or moving laundry over for the adult person. They're blowing up left and right because they're doing household chores. They're not even at school, they're not even at work, and they're like still flaring up. So when people say, I was at home for 2 weeks, I'm taking a break from school, they're still blowing up because they're still doing things at home and they don't realize that those simple things are still enough to cause them to have symptoms. So teaching these people what to do if they were to take that time off or even apply those skills at school, we don't even keep people from school anymore because we teach them how to get through their day successfully with school accommodations so they know how to use them. They know how to take the breaks. They don't need to write notes and look up at the board constantly back and forth. That's enough to cause dizziness. That means that that's the first warning sign. And guess what? The period just started and I'm still taking notes and I'm pushing and now I'm getting headaches. And then they blow up and it's only second period and they're wiped out for the rest of the day because they were taking notes. So we tell them to get handouts so that they don't have to write notes all the time as accommodation. You bypass that. Or if you know you're the dizzy type, I don't need to keep moving my head around. I can look straight at something that's fixed gaze and I can still bend down and put my socks on. I can still put laundry back and forth, but I'm looking at something that's not moving and I can still do the same task. If I know what's wrong with me, I'll do it differently. And you can still be successful with your day. And the third part is the cognitive piece, which is the most frustrating part for people, especially type A people. And I say type A because that's just an example of the people we deal with. And we have to individualize our care to these people. You know, we have to individualize. If we have to individualize an ankle sprain to somebody because it depends on what sport they're in, well, I'm a pianist. I'm like, then have at it. Do whatever you want to do. Play piano all you want. It's not going to hurt you. It's not stopping you. But I'm the cognitive person. All right, that means that that part of the brain is injured. That means that if I'm talking like this and I get to the point where I'm stuck or I feel like I'm stuttering, I can't find my words, that's cognitive. And what do people do? They keep pushing through. They want to find those words, push, that they get a headache and they keep pushing to try to find what they were going to say next and they blow up. If I get to the point where I'm stuck and I'm like, I can't get what I was going to say, you know how you talk to a conversation with people and you're, oh my God, what was I going to say? It's on the tip of my tongue. Oh my God. And it's so frustrating for those people because they're so used to go that they can't help when they're stuck. They feel slowed down. Your cognitive function causes your a delay in your processing speed. It takes me longer to understand a simple conversation. And you keep comparing yourself to the way you were before the concussion. And all you do is like, I used to be able to do this. This is so frustrating. I used to be able to calculate this without having to use a calculator. Like it just let it go. So that's when the psyche thing pops up. That's when the anxiety and that comprehensive approach comes in where you have to let them know you wouldn't be questioning every time you had an ankle pain because of the fracture you have in your ankle. Would you be questioning every day that you had pain? Why is this happening to me? I don't understand. Why does it hurt so much when I walk? Because you fractured it. Oh, but I don't get it. I used to be able to run. But you fractured your ankle, let it heal and you'll run again. But I used to be able to run marathons. I don't understand. Why is this happening to me? It causes another layer of the psyche that does overwhelm that person. And it prolongs those concussion symptoms if you don't talk about that. So I am pretty vivid and I am pretty crass when I say, well, I can't say it here, but you're stating the obvious to them, you know, in front of their parents. And you say, look, you know, would you do it if it was your ankle? Would you be complaining? No, because it's broken. But I need you to accept that this is just part of the course. This is part of the package deal of getting a concussion. Not everybody gets a cognitive issue. Not everybody gets the vestibular issue. Not everybody gets the ocular issue. It depends what part of the brain you injured this time. Excuse me. What part of the brain you injured this time. And you have to let them know about that. And the more you teach them about this, it's like being in denial, and then you finally accept it. By the second visit, they're more accepting, and then you reel them in, they understand, and that's when you start to see them getting better quicker, because you calm that part down, you don't ignore it, you bring it to the surface. So the cognitive piece is so overwhelming that the best part though is that you can control it. We give accommodations to kids at school because imagine them taking a test and question 1 makes sense, question 2 makes sense, 3, 4, 5. I'm stuck at the point where I don't understand question 5 anymore. And I'm a type A, straight A student, high achieving honor student. And I study my ass off weeks before this, and I can't understand what question 5 is. I'm stuck. Teaching them to know that at question 5, if I just put my pencil down for a few seconds and relax, stop worrying about question 5, I go back to question 5 and it makes sense. 6, 7, 8, 9, 10 makes sense. 11, 12 makes sense. And then I get stuck on 13 because I'm building it up again. I'm making my brain work. The wheels are turning. I'm making it work so hard. I'm stuck again. I'm confused. But when they get frustrated and they just panic and they start to push through 13 and they can't make sense, time is going by. Now they're getting headaches in the middle of question 13. Time keeps going and they pop. Now they wasted the rest of the afternoon because they blew up. They're wiped out. Lights bother you, noises bother you, you're irritable. You're not going to understand anything after that. But if they stop at the point where that first balloon just fills up and they're getting confusion, the point of confusion is the trick for that one. You just stop focusing on that. And within a few seconds, they can go right back and continue where they leave off. The same thing with homework. We tell them less homework, more time to do it because they need more time to understand their homework assignments. They get through a 1 paragraph, 2nd paragraph, 3rd paragraph, confusion kicks in. It didn't make sense to them. They get frustrated and they reread that section over and over and over again, and they're getting a headache from it. Instead of just stopping, go get a glass of water, come back, that 3rd paragraph makes sense and they can continue from that point on. Sometimes I just need them to stop for a few seconds. Understand that we're not telling people not to do anything. We're telling them to pause, not just pause when they feel like it, to pause at the time the moment comes on that problem came on. Most people, we have checklists. We have type A people who have a list of, I got to get this done, I got to get this done, and crossing off lists. And then that's what makes people feel good. That's what the OCD-ness comes in, that we all have a little bit of everything. Every one of us has something. And so that's why we all manage concussions differently. And that's why we can tolerate it differently. So picking out the right person, the profiling of these people makes a big difference to tell you which way to go with them to help accelerate that progress. But you got to find out what kind of person you're dealing with, because a lot of people don't even tell you. You almost have to bait them to tell you, what else are you dealing with? Are you having a hard time understanding what I'm saying? I don't understand. They blocked you off for half the conversation. That cognitive piece is the worst part for them. But there's an answer. They're going to get better. And we have things like, we have resources like speech therapy for the cognitive aspect of this. Speech therapy, the misconception is that it's a school thing and it's for people with second languages or to help people who come with a different language and linguistics, but it's about cognitive therapy to help speed that up for these people. So a lot of people don't even know that we have that as an option. Positive stress has been very helpful with us, especially in that age group, and especially being available to them in different regions. But speech therapy has come a long way for me, and understanding what they do and be able to throw people in that direction has helped them speed up their recovery, because now you're helping those brain cells come together even sooner if this is being prolonged. Because after 3 months, we don't call it concussion anymore. We call it post-concussion syndrome. But what else is causing that post-concussion syndrome? It's not the concussion anymore. That concussion was a ripple effect, that rock that caused that ripple effect. And now if the ripples had not gone and they continue after 3 months, 3 months to a year, we call it post-concussion syndrome, but there's always something else causing that. Usually anxiety, depression, ADHD, anything, external factors, if you look at it that way. So we will help treat the bottom line, the underlying problems, such as, the symptoms, such as a confusion, I can't calculate that well, my memory is shot, my reaction time is shot. But we have to find out what else is causing that. In this case, we have to address the anxieties or something else that's causing this. But people don't want to deal with that. They don't want, it's taboo. So I like to talk about that early in the first few visits as an option to make sure that we're not dealing with something 3 months from now. And people appreciate it.
Dr. Alcala, we do have one question. If a patient overdoes it when recovering from concussion, is that going to delay the complete recovery time?
If they overdo it, no, it feels like it just holds you back a little bit. but understanding that if you're doing too much, you just tweak it. And that's why you come to us periodically, so we can get the feedback, so we can say, why is this one taking you longer? And so many times in the second or third visit, they're telling us, I went to this party and I just felt awful the next day. You know, they think that they're hurting themselves. It's just prolonging it a little bit. Getting them back on board and getting them back to, hey, you know what you can do? You could go to the party, but as soon as you felt it, you could have gone to the bathroom for a break and come back and continue where you left off. Or, hey, instead of talking to 3 people, let's go to the room and we just talk to you one-on-one. Hey, keep the conversations light. There are ways to get around those situations, but it's just more feedback, and it's only going to stall it a little bit, but it's not going to be prolonged like months if that's what you're concerned about, or weeks. It's just a couple of days of a setback if you're concerned about that. And it's okay to test the waters too, by the way. It's okay to try to do things because you don't know what you're capable of. But if you get a symptom, you know that's the first stop sign for you. If I get a headache, that's my second stop sign. And if I blow up, I'm done. So start paying attention, do things as much as you want. You recognize that first warning sign, pause.
Great, thank you.
You're welcome.
And I think that's a good segue to move into our executive functioning piece with Katie Bell. So, Katie,
Thank you.
take it away.
Awesome. So I work with student athletes at Army West Point. I work with the football team and the men's soccer team, as Lori mentioned. But I myself, when I was in 8th grade, I was tested for ADHD, all kinds of stuff. And I was diagnosed with executive dysfunction. And so what that meant for me is my brain is naturally very disorganized. And so my one thing that was really helpful for me, and for my mom, the story that she tells, is that my room was always a mess, and she would tell me to go clean my room, and I would never clean my room. And internally for me, it was because I couldn't make sense of organizing that large of a project. And so I just shut down and I didn't do it. And so what she was taught was that she needed to break that really big project into smaller projects. So, you know, it's Tuesday, go clean off your dresser. It's Wednesday, clean off your floor. It's Thursday, clean up your closet. And that made it, for me, with my executive dysfunction, so much easier to be able to conceptualize that and process it and actually accomplish that task versus something so large and so overwhelming that you shut down. So then we started bringing that into school, and I met with a learning specialist in school and learned about organization and about planning and how can I help myself with my executive dysfunction be able to handle so many big things like writing a paper, studying for a test. Those were the equivalent for me of clean your room. So how do you break those things down into smaller tasks? And so then from there, my ability to learn, I have then brought that into my career, where now that I have learned all of my external functions, to be able to keep myself organized and on task, I teach others how to do that. So this is for the maybe non-type A students, the ones who struggle with the organization piece, with the time management piece, some strategies that I use with my student athletes. So for those who maybe have signs of ADHD, these can be very useful, or for executive dysfunction in general. So one strategy that is extremely helpful in breaking the big things into small things is what's called backwards planning. This is when you start from the due date and then work your way backwards from that due date. So instead of hearing, okay, you have a paper in 2 weeks, you should start it, being able to work backwards from that date and break it into smaller chunks helps you not only see when you need to start that, and so then you're not stressing or have any anxiety about when you need to get that done because you already have that planned out, but it also allows you to turn that really large assignment into smaller homework assignments. So for example, if there's a paper due in 2 weeks, what should we be doing the day before that paper? We should be doing revisions. The day before that, maybe you go see your teacher. The day before that, you're writing a conclusion paragraph. The day before that, you're writing your third body paragraph. So breaking those down into smaller chunks allows students to be able to not feel overwhelmed by the task at hand and not procrastinate, because it's extremely easy to see on your planner, I need to start my paper, but it's due in a week and a half. I can put that off, no problem. I can do that later. But then that keeps happening day after day. Whereas if you saw in your planner, today I need to write one body paragraph, that's much more doable. The other part of that is helpful with breaking those small things down and making them extremely specific tasks is that it has this light at the end of the tunnel approach that I think is necessary for every single task that someone needs to complete. Because again, the concept on your planner of start your paper, what does that look like? Where does that start and where does that finish? There isn't that light at the end of the tunnel. So again, it becomes really overbearing and anxiety producing. Whereas if I just have to write one paragraph, there is a start and an end to that. It starts with a topic sentence and it ends with a transition sentence. And I can easily cross that off my list and feel good about where I'm finishing the day. So that is an extremely important piece in order to help someone with executive functioning challenges be able to overcome those long-term projects, larger projects. Another important piece that I think can go along with the concussion is what's called the Pomodoro technique. And this is timers essentially. So especially for someone who may have ADHD, this can be extremely useful. And if you are needing to force someone to slow down as they're recovering from a concussion, it could potentially be useful as well. So the Pomodoro technique is where you create a immediate task list of what you need to get done. And then you start a timer for 20 minutes or 30 minutes. And then you work and do your work until that 20-minute timer goes off. You stop, you set another timer for 5 minutes. And during that 5 minutes is your break. I personally recommend, because all of my students tend to go and look at their phones during those 5 minutes. That's not the most useful use of your time during those 5 minutes, and it doesn't help you really recover from perhaps what can be a lot for someone who has executive function, ADHD, or is recovering from a concussion. So instead, get up, take a walk, go talk to someone for a few minutes, but then as soon as that timer goes off, you set another timer for 20 minutes, and then you keep going with your next task or continue the task that you were on. The Pomodoro technique says that you do that 4 times, and then you have a longer break of 30 to 45 minutes. So I have found that this is extremely helpful for those who have attention deficit issues, extremely helpful for those who feel overwhelmed by the tasks at hand, because again, it allows this light at the end of the tunnel situation where all you have to do is work for 20 minutes and then you can stop. Whereas not really seeing where that is going to end, that in my opinion is the most difficult piece for someone, is being able to see, when can I stop? When is this going to end? This is overwhelming. So being able to create those stop times or those stop deadlines is the most important thing for executive functioning. Additionally, meditation and mindfulness, I have found, is an extremely important tool that I use with my student athletes. I use apps like Headspace or Calm app to do meditations with them. I believe, and Dr. Alcala, you can jump in if you'd like, but I have found that a lot of my students who also are recovering from concussions find mindfulness meditation very useful. And it helps my students with attention deficit issues as well. I don't know if you want to speak on that at all.
I do notice that, can you guys hear me okay? I do notice that when people have ADHD, that it does take a longer time to recover from a concussion. However, when someone has a concussion, I always tell them that you might notice that your child is having more difficulty concentrating. They're bouncing around more than usual. They're like, yeah, we're noticing that too. And I don't understand that they're on medication. I'm like, yes, the difference is that when a concussion, before the concussion, your ADHD, it's matched with your medication dose. In a concussion environment, the ADHD symptoms are through the roof, but your dose stayed down here. So imagine your brain erratic. When is it going to relax and when is it going to get better from the concussion? If your mind is all over the place like this, I need it to be relaxed as best as possible. And then you start to see them get better. So that is a conversation I like to have people early on, but we still focus on the current symptoms, the current balloon model, and try to get them through it anyway, because there's a chance that it doesn't have to infiltrate the concussion. It doesn't have to prolong the symptoms if we can make them be focusing on the current symptoms. And that allows, and preventing those flare-ups that I talked about. So despite any background history that they have, they still can get better if they stop flaring up all the time. But I also want them to understand that those symptoms that they have that are through the roof, anxiety can also be amplified, depression can be amplified, ADHD can be amplified. So trying to be aggressive in advance, trying to tell them that, hey, don't be surprised if your dose has to be increased to match your new symptoms. But once your concussion goes away, you might realize that the dose might be too high for those symptoms and we can bring you right back down to baseline again. So everything we do is all temporary, but awareness of that, I think, calms people down too, because they're like, what's wrong with my son? He was fine before this. So yeah, that's my approach to the ADHD part. And I'm interested in this because my son does have ADHD. I think I may have too, I don't know. But my daughter too, and it's just hard because it does take a toll on everybody, not just the child.
Yeah, absolutely. It's thank you so much. It is a lot, and it's really frustrating. It was really frustrating for me before I knew I had executive dysfunction. It was extremely frustrating for me, and I would shut down a lot. And I see that in my student athletes. It's just shutting down, frustration. So my number one piece is, let's just do something small and not try and overhaul your whole system, but let's try backwards planning and see if we can break these big tasks into small tasks. Let's try timers and see if we can make it so that maybe you can focus for 20 minutes and then you can take a 5-minute break. We don't need to do 100 things at once all the time. And again, this is the non-medication approach, but just more the academic and organization approach. Medication's great, but for also it's important to try these little tasks as well, and these ways to make it so that your very large planning does not shut you down, and you can make these really, really big tasks into small tasks as much as possible to make it just a lot less anxiety producing, a lot less likely to shut down, and also increase confidence. Because as soon as I see my students cross something off their to-do list, they have a huge smile on their face. So for someone who has a hard time crossing things off their to-do list because everything's too big, or they can't focus for long enough, or they're not organized enough, being able to break that down so that it is easier and they can more quickly cross something off their to-do list is a huge confidence booster and makes a really, really big difference. I think the final piece and tool that I think is also useful for organization is, if you think of the acronym OHIO, only handle it once. That is something that I tell my students all the time, is when you're handed a piece of paper or you receive an email, you need to do something with that, because far too often I open up backpacks and just see papers flying everywhere and crumpled up, and they're important papers. And so I make it so when you get that piece of paper, you either need to have a folder for papers that you're going to deal with later. If you don't have time to do it right now, then have a later folder, or put it immediately in your binder, but never say like, okay, I'm going to throw it in my bag and deal with that later, because you never do. So having some type of system, even if you don't have time right that minute to do something, then have a folder for the do it later. And then that folder is also a reminder to then organize it as well. So only handle it once. For an email, either mark it as unread, reply, put it in the trash, flag it, do something with it, but don't read it, then say, I'll come back to that later, because you're not going to come back to it later. The number one thing is and I tell them, don't rely on your brain, because your brain can sometimes fail you. You need to rely on outside external tools. I can't rely on my brain. I have to rely on Post-it notes and planners and to-do lists because I won't remember. And then finally, I'll leave you with just a couple helpful apps that I've found. One is called Tick Tick. And it is a to-do list on your phone. So my students, it's really hard for them to do paper planner and pen to paper stuff. And so I've found that Tick Tick is useful because all you have to do is it's a virtual to-do list where you can set reminders for yourself. Remind me of this at this time, and this time, because they're always looking at their phones. And so that's really useful. And then Notability as well, because Notability, you can take, if they have like an iPad or something, notes on the iPad, you can put PDFs in there, and then you can have the Notability read the PDF to you for those who struggle with reading. But it's a really useful app. So yeah, thank you.
Wow, Katie, that was awesome. The first time that we actually did an educational in-service on executive functioning, I looked at the topics. I'm like, oh yeah, I've got 3 of those at least. And I know my kids have like several of them also. So we really appreciate your insight into that. And especially with, our athletes that are struggling, post-concussion, post-injury. As you mentioned, the ADHD, the other components definitely add another dimension to that. So thank you so much. We appreciate that. Lauren, is there any other questions, or is there anything else that, Katie, Dr. Akala, that you would like to add to this before we wrap up?
We did have one question, then I will, and I can actually put it in the follow-up, but Katie, if I can get the names of the apps and some of the other sites that you suggested afterwards, for everyone listening, we'll send those around so that you have the names of all of them, because we did have someone asking for them.
Yeah, absolutely.
Yeah, I would love them as well.
Yeah.
So, okay. So Lauren, housekeeping, we have a survey, right? That
Yep.
we would like to ask everyone to fill out. And please, we will have this available for a future review of it. So if you have like friends that you think would benefit, if you have coaches that you think would benefit from this information, by all means, share that with us and share that with them. And then if you have any other topics that you'd like to see us gathered, like this group of expert presenters for, please let us know that as well. But thank you so much for the time tonight. Everybody have a good night. Stay safe, be well, and thank you again. All right.
Thanks, everyone.
Thank you. Bye-bye.
Thank you.
Bye-bye.